Hello there. So was it just a week or so ago when we were talking about the cyclone hitting for Odisha and West Bengal and wondering about the impact that could have on coronavirus? And now there's a cyclone heading towards Maharashtra and in particular Mumbai, one of the most affected areas of coronavirus, perhaps the epicenter of coronavirus in India. So the cyclone's heading there, and there will also be an impact in places like Gujarat. So our thoughts, of course, and our prayers go out for everybody who is in Maharashtra, who's in Gujarat, who's in the path of the cyclone. Do stay safe and do remember, even as the cyclone approaches, that coronavirus is still there. And so you've got to take care of that as well. We'll, of course, keep bringing you all the updates on whatever happens with the cyclone. But let me just shift for a couple of minutes to some of the information that's come out with the government today on coronavirus itself. And it's very clear that what the government seems to be saying is don't worry about cases are rising, but the numbers for India aren't that bad when it comes to deaths and fatalities. And two or three specific things put out by the government today, which I think merit a certain amount of discussion. First of all, the government said today that the fatality rate is now down to something like 2.8% or so. So if you get coronavirus, you have a less than 3% chance of actually dying. And that's one factor to keep in mind. The other thing which the government said is 73% of everyone who's died because of coronavirus has comorbidities. They've got diabetes or breathing problems or pneumonia or some other thing. So that's the second factor to keep in mind. And thirdly, what the government has said is that, look, the number of people in India who are between 60 and 74 in age, that's about 8% of the population. And that group comprises or consists of 38% of everyone who's died of coronavirus in India. And then there's another group which is even higher risk, which is people older than 75. And in that particular case, what you have a situation where that's about 2% only of the population, but that constitutes 12% of everyone who's died of coronavirus. So essentially what the government is saying is that if you look at this particular group, people older than 60, that comprises about 50% of everyone who's died of coronavirus. 73% people have comorbidities, 50% of people, obviously there'll be people who are common in both the groups, but essentially the thrust of that being, if you're not over 60 and you don't have comorbidities, you probably don't need to worry. And what's my take on that? Look, those are good statistics to keep in mind, but frankly, no one wants to entirely rely on statistics. And B, there is an issue that in India, people do stay in very close-knit families, close-knit groups. So it's not enough to say, but it doesn't matter if you get coronavirus, just keep the elderly away, because most people live in joint families with the elderly right there. So if the approach is really going to be, don't worry if you get coronavirus because you're not really likely to die, I think that will only happen when a drug comes. Maybe not a vaccine, but when a drug comes, which actually reduces the fatality rate even further, including among the elderly, including among those with comorbidities. So that's a slight digression on some of the government's numbers that have come today on who should really worry about coronavirus. But let's also shift our focus back to the cyclone that's approaching and the impact that could have.
The Met Department has confirmed that the deep depression in Arabian Sea has intensified into a cyclonic storm, prompting NDRF teams to be rushed to Mumbai and suburban areas. 33 NDRF teams have been deployed in the coastal districts of Maharashtra and Gujarat. Mumbai, which is already battling the country's highest number of coronavirus cases, is set to face another calamity, with the cyclone intensifying over the next 12 hours. The Western Naval Command has mobilized adequate resources for flood relief, rescue and diving assistance in the event of excessive rainfall and flooding of both urban and rural areas. While Maharashtra is battling a severe coronavirus outbreak, the state has another worry. Cyclonic storm Nisarga is expected to hit the Maharashtra coast on Wednesday. Mumbai and neighbouring districts have been placed on high alert. Union Home Minister Amit Shah spoke to Maharashtra Chief Minister Uddhav through video conferencing and reviewed the state's preparedness, the Chief Minister's office said. The NDRF said that Nisarga is a severe cyclone and is expected to bring in a wind speed of up to 100 km per hour.
India has recorded another day of 8,000 plus new coronavirus cases. The country recorded 8,171 fresh cases in the last 24 hours, according to the Health Ministry data on Tuesday morning. It takes the total tally to 1,98,706 cases. The death toll has increased to 5,598, with 204 deaths in the last 24 hours. India has for the last many days seen an alarming 8,000 plus increase in the cases as curbs have been relaxed, with the government announcing a phased unlock plan from June. Over 95,000 people have been cured so far.
The Union Health Ministry, in its daily briefing on the COVID-19 situation on Tuesday, said 3,708 patients have been cured in the last 24 hours, while a total of 95,527 patients have recovered so far, taking India's recovery rate to 48.07%. The Health Ministry also said that 73% of COVID-19 deaths in the country are of people with co-morbidities, adding that 1 in every 2 deaths in India has been of senior citizens, who constitute 10% of our total population. The good news is that India's fatality rate is 2.82%, among the lowest in the world. 14 countries with a cumulative population almost equal to that of India have reported 55.2 times more COVID-19 deaths. India has also ramped up testing. The government said 1.2 lakh samples are being tested for COVID-19 every day. India has 681 laboratories that are approved for testing, of which 476 are in the government sector and 205 are in the private sector.
India's top drug regulatory body has approved the use of the antiviral medication remdesivir for the treatment of COVID-19 in adults and children hospitalized with severe infection. Remdesivir is one of the most closely watched drugs in the global clinical trials to find a cure for COVID-19. The injectable medicine was approved by Drugs Controller General of India for administration as a part of the maximum 5-day regimen, the Indian Express reported, quoting sources.
13 employees of the Delhi Lieutenant Governor Anil Baijal's office and 6 other government officials have tested positive for COVID-19. Junior assistants, drivers and peons are among those working at the Lieutenant Governor's Secretariat who have tested positive for the deadly virus. On Monday, Delhi recorded 990 fresh COVID-19 cases, taking the total to 20,834. while the death toll due to the disease mounted to 523. Delhi Chief Minister Arvind Kejriwal on Tuesday launched a mobile app to help people know how many beds are lying vacant in which hospital in the national capital. He said there is an information gap because people tell the government they could not find any beds in hospitals. This app will fill that gap, Kejriwal said. The app will be updated twice daily at 10 a.m. and 6 p.m. so that people are aware of the latest status of hospitals across the national capital.
A new study, partly commissioned by the World Health Organization and published in the Lancet journal, has found that reducing physical distance from 2 meters to 1 meter could double the risk of coronavirus infection. This comes to light as governments all over the world try to plan how to reopen public spaces and offices and what guidelines to impose to minimize virus spread. Researchers found that a distance of more than 1 meter from other people reduced the risk of infection to 3%, while less than a meter of distance shot up the risk of infection to 13%. India currently recommends a distance of at least 1 meter in its social distancing guidelines. A massive review of 172 studies from 16 countries by Canadian researchers has found that frequent hand washing and good hygiene are also critical to the prevention of virus spread, along with other measures like wearing face masks and social distancing of at least 1 meter. Published in the Lancet journal, researchers found that while all these measures together are helpful, they cannot provide full protection. It was also found that current research is limited as most of our findings are based on evidence for SARS or MERS viruses. One of the authors cautioned that wearing a mask is not an alternative to physical distancing, eye protection, or basic measures such as hand hygiene.